Definition: it is the soft tissue that covers the vault of the skull extent, anteriorly, supraorbital margin. Posteriorly, external occipital protuberance and highest nuchal line. Laterally, superior temporal line. The scalp is formed of 5 layers. The letters of the word scalp indicate each of these layers. S for skin, C for connective tissue, A for aponeurosis, L for loose areolar tissue and P for pericranium. Rich in sweat and sebaceous glands. Common site for seborrhea and sebaceous cyst due to blockage of the duct draining the sebaceous gland. Connective tissue. It is a dense connective tissue, containing arteries, veins, nerves and lymphatics. It contains also septa that connect this layer with the layer above and the layer below, thus the first 3 layers are adherent. The septa divide the layer into partitions that are filled with fat, since the connective tissue is dense. However, it causes pain. Wounds do not gap. A small wound causes profuse bleeding because the walls of arteries adhere to the connective tissue septa, which prevents them from contraction or retraction. Aponeurosis: a strong fibrous sheet adherent to the first 2 layers. Anteriorly, it receives the insertion of frontal bellows of Occipitofrontalis. Laterally, it is attached to the superior temporal line. Posteriorly, it receives the insertion of occipital bellows of Occipitofrontalis. A wound reaching this layer gaps because of contraction of the muscle. Occipitofrontalis muscle. It has 2 frontal and 2 occipital bellies. Origin: frontal bellows are wider, partly united in midline. Each arises from the skin of eyebrows. Occipital bellows are narrower, separated from each other by an extension of epicranial aponeurosis. Each arises from lateral 2/3 of the highest nuchal line. Insertion: epicranial aponeurosis. Nerve supply: A frontal bellows, temporal branch of facial nerve. Occipital bellows, posterior auricular branch of facial nerve. Action: frontal bellows pull the scalp and eyebrows forward, producing transverse wrinkles of the forehead. Occipital bellows pull the scalp backwards. Blood supply: the scalp has rich blood supply. The arteries anastomose freely with each other. They are branches of either the external carotid artery or internal carotid artery. Arteries of the scalp: supratrochlear and supraorbital. Both are branches of ophthalmic artery from internal carotid artery. Superficial temporal artery, one of 2 terminal branches of external carotid arteries. Appears at the upper border of parotid gland. Ascends in front of triglyceria where its pulsations could be felt. Supplies skin of temple and side of scalp. Posterior auricular artery. Branch of external carotid artery. Passes above postbelly of digastric muscle. Supplies scalp behind the ear. Occipital artery. Branch of external carotid artery. Ascends below posterior belly of digastric muscle. Supplies back of the scalp up to the vertex.
Supratrochlear artery. Supraorbital artery. Superficial temporal artery. Auricular artery. Occipital artery.
Veins of the scalp. Veins of the scalp accompany the arteries and have similar names. Veins of the scalp anastomose freely with one another and are connected to diploic veins of the skull bones and intracranial venous sinuses by emissary veins. Supratrochlear and supraorbital veins unite at the medial angle of eye to form the facial vein. Superficial temporal vein unites with maxillary vein inside parotid gland to form retromandibular vein. The latter divides into anterior and posterior divisions at the lower end of parotid gland.
Supratrochlear vein. Supraorbital vein. Facial vein. Superficial temporal vein. Retromandibular vein. Posterior auricular vein. Anterior division of the retromandibular vein. Facial trunk or common facial vein. Internal jugular vein. Posterior division of the retromandibular vein. Occipital vein. External jugular vein.
Emissary veins. They are valveless veins that pass through skull foramina to connect veins inside the cranial cavity, venous sinuses. With veins outside the cranial cavity, some are constant, while others may be absent. They help reduce venous pressure inside the cranial cavity, but they may be the routes of spread infection from outside to the cranial cavity. Example: parietal emissary vein pass through parietal emissary foramen to connect veins of the scalp. With superior sagittal sinus inside the skull. Nerve supply. The scalp is supplied by 10 nerves, 5 in front of the auricle and 5 behind the auricule. In front of the auricle there are 4 sensory nerves, branches of trigeminal nerve. Supratrochlear nerve, supplies skin of forehead. Supraorbital nerve, from ophthalmic nerve, supplies skin of forehead up to the vertex. Zygomaticotemporal nerve, from maxillary nerve, supplies non-hairy part of temporal region. Auriculotemporal nerve, from mandibular nerve, supplies the hairy part of temporal region. One motor nerve, which is a temporal branch of facial nerve, supplies frontal belly of Occipitofrontalis. Behind the auricle, there are also 4 sensory nerves, branches of cervical spinal nerves. Great auricular nerve, from the cervical to and 3 nerves, supplies skin over the mastoid process. Lesser occipital nerve, from the 2nd cervical nerve, supplies skin of scalp behind auricle. Great occipital nerve, from the 2nd cervical nerve, supplies skin of scalp up to vertex. 3rd occipital nerve, from the 3rd cervical nerve, supplies skin of lower part of occiput. One motor nerve, which is a posterior auricular branch of facial nerve, supplies occipital belly of Occipitofrontalis. Lymph drainage. Preauricular region, drained by parotid lymph nodes. Postauricular region, drained by mastoid and occipital lymph nodes. Revision on the nerve supply of the scalp.